My name is Haley McIntyre. I will be performing a intramuscular injection using the Z-Track method. The first thing I'm going to do is assess the patient's health status and obtain a medication history prior to giving any medications. I'm then going to verify the provider's orders against the MAR, and today we are given Thiomin at 100 milligrams, and these come in, it's a 2 milliliter vial. I will actually be giving 1 milliliter of that, not the entire thing. I'm then going to perform hand hygiene. I'm going to visually inspect this medicine for any kind of contamination, and everything looks good. I also would check the expiration date to make sure that it's not expired. I'm then going to get my needle or my syringe here and get my needle ready. Aseptically attach that by making sure I don't touch that bottom part and I don't touch that bottom part there. Snap those into place, keep that cap on there. Okay, so the next thing I'm going to do is I will clean the top of my medicine vial with an alcohol pad for 15 seconds. I'm then going to take off the needle, the cap to my needle. And I'm going to draw up 1 milliliter worth of air. I'm then going to insert the needle into the vial. And then I'm going to put that air in there. Excuse me for my kitten. I'm then going to leave the needle in the vial, and I'm going to invert the vial. And I'm going to put the amount prescribed into the vial. While I'm doing this, I'm going to assure that I'm not getting any kind of air bubbles. I would then confirm this with another nurse. So I can go ahead and take that out. I'm going to put the cap back on here. And then I'm going to, because it's intramuscular and that so none of the medication goes into the subcutaneous tissue, we would actually be changing the needle so that way it doesn't hurt the patient, and we're doing intramuscular. We are then going to open up this new needle here. And make sure I do it the same way I did it last time, aseptically. I would then label the syringe with the medication and the amount. I would put Thiomin 1 milliliter, and I would then go ahead and verify this dose again with another nurse and with the MAR, just to make sure. So then I can, with the cap still on, I can go ahead and set this down. I'm now in the patient's bedroom, and I'm going to provide some privacy by pulling the curtain. I'm then going to perform hand hygiene, and I would raise the bed if need to be for comfortable working height. I'm going to go to the patient and verify their name using their I'm going to check their medical ID bracelet and check for that medical record number. I'm then going to ask the patient to give me a second verifier, such as their date of birth or their name. I'm going to then compare the name of the medication on the MAR versus what I have one more time. I'm going to explain to the patient that I'm going to be performing an intramuscular injection of the Thiomin 1 milliliter per provider's orders. I'm going to then apply some clean gloves. I'm going to loosen the needle cap, but I'm not going to take it all the way off. Oops. Well, it came all the way off, so I'm just going to slide that right back there like that. Set that back down. I would then identify and assess the area in which I'm giving the injection to ensure that it's not tender, it's free of any lesions, lumps, nodules, scars, or any kind of bruising. You can do this in the deltoid, vitrogluteal area, or the vastus lateralis area. So what I'm going to do is use the non-dominant hand to displace the skin laterally by pulling it 1 to 1.5 inches away from the intended injection site. I'm then going to use a alcohol wipe to clean the injection site using my dominant hand. And I'm going to do that in a bullseye fashion. Clean that area here. I'm then going to remove this cap again right here. And then I'm going to hold my needle like a dart. So I'm going to insert it like a dart. So I'm going to continue to displace the skin. And this is going to go at a 90-degree angle. Stick that in there. I'm going to continue to displace the skin, and I'll aspirate as needed. Inject that medicine slowly. And then after all the medication is injected, I'm going to actually hold this in for about 10 seconds so I can allow all the medication to get through to the muscle. I'm still displacing the skin with my left hand. Once I have done that, I'm going to quickly withdraw the needle and then lift the dominant hand to release and displace the tissue, allowing the tissue to return to its normal position. I'm then going to apply gentle pressure to the injection site. Pull up that safety shield there. I would then assist the patient to be comfortable again, and I can go ahead and discard all of my items. I would then perform hand hygiene again. And what I would document is medication, dose, route, injection site, patient tolerance to the procedure, and patient teaching and response to learning. I would also evaluate patient's response to the medication when it would be in that appropriate time frame. Thank you.